Ooh, you was close. I was like, was he gonna make it?
I feel like you're getting excited, man. I feel like you're getting excited, man.
He was giving me like, yo, you gonna turn your camera on?
Huh?
I was like, if you gonna turn the camera on or no? You had me nervous.
Yeah. We're going.
All right, well, we ready. Let's do this, y'all. Y'all know what it is. Welcome back to More Than the Title. It is our favorite day. It's actually, we added this day. It's not our usual pod day, but we needed to because we got so many Black women that we want to celebrate this month, and today is no different. But you already know this is episode 196. I'm your host, as usual, Jarrett, Chief Revenue Officer at Outside the Box Digital, and I got my brother, my brethren, your favorite CEO, Cuzzo. What's the vibes?
Hey, man, feeling good, man. Feeling good. You know what I mean? I love the fact that we've been getting such an amazing response for celebrating these Black queens out here. You know what I mean? So I want to just shout out us and say grateful and thankful that we took up to the challenge, the mantle to celebrate our Black queens all month long. You know what I'm saying? Because it should be longer than a month. It definitely should be longer than a month, but progress has to start somewhere. You know what I'm saying? So, you know what I mean? So, so ladies and gentlemen, welcome to another show, More Than the Title. You know what it is. G&T, as always, grateful and thankful. Like I said, we're grateful at the fact that we've been getting so much support and just so much love and the outpour of just gratefulness from the community for supporting our Black queens. But just understand that we don't do it for acknowledgement or recognition or anything like that, right? We do it because we want to do it and it's the right thing to do. And we believe in it, you understand? And thankful, like Cuz I always like to say, because we're growing and glowing. We put up the stats the other day. I think we got in contact with another like 17,000 accounts or something like that. You know what I mean? Right. Our YouTube numbers are going up. Our reach is getting further and further. And we just want to say thank you to all the people out there, the new listeners, the old listeners that keep supporting the show. You make it possible for us to keep going. G&T.
Absolutely, man. Well said, my brother. And shout out to another Black queen. Shout out to Angel Live, is the entire live podcast team. You already know, if you want more content like More Than the Title, it's the first woman-owned, Black-owned podcast network in the world and the largest Black-owned podcast network. So if you want content like More Than the Title or any other amazing content they got on there, make sure you take your phone out, scan the QR code, download the app from the App Store, and make sure you subscribe. And half of your subscription money goes to the content creators of your choice. So we don't just talk it, we walk it, y'all. We support our people, man. It's a time to be alive. You dig? And with that said, anything you want to add before we get to the shits?
What a time to be alive.
I like it. I like what we're doing.
Let's start the show.
We going with this. First of all, before I give this queen the introduction, this is a crazy introduction. She's the truth. Before we get into it, you know what I'm saying? We met this queen at Black Week. We had an amazing time. We were doing in-event, interviews. They were just coming off the stage. Dr. Sophie was there, along with Gina Pemberton. You just seen her last week. We had a great panel. We had a great discussion. And just like the challenge we made to everybody else, we made sure we want to stay in contact. As soon as we finished that first conversation, we was like, we just have to have you on. We have to hear your story because, it's inspiring and it needs to be told. So with no further ado, this queen is brilliant. She's a clinical professor of medicine in the Division of Gastroenterology and Hepatology at NYU Grossman School of Medicine. Not only is she an expert in inflammatory bowel disease, but she's also a fierce advocate for diversity, equity, and inclusion in healthcare. She currently chairs the American College of Gastroenterology Diversity, Equity, and Inclusion Committee, co-founded their Diversity and GI social media campaign, and is the proud president and co-founder of the Association of Black Gastroenterologists and Hepatologists, ABGH. Make sure y'all look into it. Her work has been published in some of the most prestigious medical journals. She's nationally recognized for elevating conversation around DEI and patient care. From Princeton to NYU, from the classroom to the clinic, she's reshaping what it means to lead in medicine, y'all. So if y'all seen her in the doctor's office, y'all seen her in the classrooms, y'all seen her at Black Week on the stage, and you see her in the boardroom, man. And for the very first time, she's on your favorite podcast, rocking with your boys, man. Let's introduce the queen, Dr. Sophie Balzora, y'all. Yeah. Robe too. I love that you brought the robe. Hey,
that's a hell of an intro. I ain't gonna lie.
I need to take you guys with me everywhere I go. I love that.
We like the
ultimate. What are you talking about?
Yo, we gotta be. I'm all for it, man. But first of all, thank you, King, for pulling up. And you're still in the office right now, right?
I'm still in the office.
Yeah.
Yes.
Thank you.
At home.
Listen. We when we do these intros, we just want you to understand that it's not just us reading off your accolades. Like, we actually believe in what you're doing, and we find it to be like truly important to us personally and to society for them to hear, not only see you, but hear about your accomplishments before they hear your story, right? So that way they can tie it all in and say, wow, like this woman is truly amazing. So that's why we give out these flowers like that, because and then sometimes you do so much that sometimes you don't give yourself the credit, right? Yeah, you don't give yourself the credit, right? So we want to make sure that you're recognizing your hard work and then things that you've done for yourself. So that's why we give those intros like that.
Thank you. You're right. You're right.
Absolutely.
Sometimes you forget when you're like, in the thick of it. So I appreciate that.
That's real, Queen. So, for first-time listeners and everybody here, y'all know how we like to start, man. First of all, Queen, we don't want to know. Tell us a little bit about your upbringing, some early influences, so we can get the mindset.
Sure. So, I was born in Queens, Flushing, Queens.
Shout out to Queens.
Shout out to Queens. Money.
To two Haitian parents, right? So they were born and raised in Haiti. So I am a Haitian American, first generation, youngest of three. Yes. So we, when I was pretty young, we moved to the suburbs of New York. So we were about maybe like 45 minutes to an hour away from where I was born. And, when I think about where I am now and what I was kind of destined to do, I have to give all the credit to them, all the credit to my parents, all the credit to my family. There's just no way that anything would be possible without them. So, and I think, I mean, the older I get, and I have a 6.5-year-old daughter, the more and more that is obvious to me. It's one of those things you just don't appreciate then, but now you're like, wow, like, how did you guys? Wow.
As a parent, them lessons hit you hard as a parent. Like, we like, God, yeah.
Yes.
That was you told me this at 6? The basic advice that be the realest.
They were very much like, they didn't, there was only one option. Success was the only option. It was like, that's all, that was the expectation. So that's what you're always expected to be great, to do your best. And I think that, especially where I grew up, it was like predominantly white, right? So I was definitely like the only chip in the cookie, like except for my siblings. So I think that message was even more important. It's like, no matter what anybody says, no matter what they try to do, no matter how they try to make you feel, this is your reality, is that you are, destined to do great things, and we expect nothing less of you.
Message. The only chip in the cookie is crazy though. I ain't gonna hold you. I've never heard that. The only chip in the cookie. I've never heard that. I was sitting here. I had to process that shit.
I had to do it too.
Cookie? Like, I've never heard that before. Like,
no,
I've never heard that one before.
Implement immediately.
I mean, it's not a very. I mean, I thought a lot of people said that. No.
Yeah, I like it. I just never heard it before, so it just took me a second to process. The only chip, I had to say it to myself like 3 times. I don't know if you've seen when I think the wrinkles does go across my forehead. I don't know if you see me think, but the only chip in the cookie.
Because they also say only fly in the milk, but I feel like that's more like a negative. Like nobody
right? Yeah, okay, that makes sense.
But chocolate chip.
But let me ask you something too, Don. What did mom and pops do, if you don't mind me asking? So you get like, what were they doing? Like entrepreneurs, teachers, something like that?
Good question. So my dad is a doctor too. He's now retired.
Oh, okay.
Yeah, during COVID, he's like, deuces, I'm out of here. This is crazy. He was a doctor in the Bronx at Lincoln Hospital.
He's seen some shit. Oh no.
Yeah,
oh man, exactly. Not Lincoln. Oh
yes,
Lincoln.
Yes, he's been there for he was there for decades.
Right.
And then my mom was a nurse. So very like medically oriented family. So, they're trying to churn out doctors. So my sister's also a doctor, actually. She's in DC. So she's a doctor. My brother escaped the medical field, the smartest one of all of us. Smart man. But yeah, so they were in medicine, and like we just kind of followed their path. But I really just think about, all the times, and there were subtle things, and then there were more obvious things. And there's so many things that now I think about, and I was like, shit, she was right. especially my mom, like,
Yeah.
like, she was right. Like, wow, and I mean, I only tell her some of this. I don't always admit that to her, but but
Give mama the flowers. Matter of fact, let's give you a chance to give mama the flowers now. What's some of the best advice mama gave you ever? What's the one game that sticks out that you'll tell your daughter? Damn, that's a good one.
Yeah, that's a really good one. Wow.
Hey, why not?
Yeah, I mean, I think the biggest one is basically like not to let anyone else try to tell you who you are. Like, I think there are so many things that work against us, that in so many ways people try to kind of put you down and try to put you in a box, or think that you're going to be in a certain space, and that's just not it. Like, where you came from, who raised you, what what your potential is. So don't let anybody else try to tell you different. And I think that that's just such an important lesson, in so many ways, especially when you're like the only one, or like you're one of very few.
Yeah,
that's real.
Yeah, I mean, I think it's just very easy to fall into that trap, and so I think now, even more than before, that is such an important lesson that I tried to tell her, and she's young, so I'm not saying that in that way, but just, I see these certain examples, and you see how things can go a certain way when you talk about people's hair, when you talk about the color of their skin and different shades of their skin, and what people eat, and it can manifest in so many different ways.
It's a lot.
So yeah, I think that that's like the biggest life lesson that has served me very well. So
I got a question though. I want to get a little deeper into this. So both parents are in the medical field, and we talk about this all the time, about parents being successful in a certain field and wanting their children to follow, right? So the question is just like, did they want you to follow and leave you kind of like subtle hints, like, you could follow us if you want, and it was your decision, or was like every Christmas and birthday you getting like stethoscopes and lab jackets for your birthday? You know what I'm saying? Like,
the stethoscope present is crazy.
Like, we just curious, because obviously, right, when you do well, you do want, especially if you do well and that your children can follow. A lot of parents want to have their children follow, but more often than not, children like to do their own thing. So I'm just kind of curious of what that was like at home. Was she always using like big doctor's terms at home at the dinner table? Like, like your knee bone is not actually called the knee bone. It's called, you know what I'm saying? Like, what was that like?
Effect,
yeah.
That's a great question. Yeah, there was no choice.
Okay.
Like, explore different. No. That definitely wasn't happening. I remember one time I mentioned I wanted to be. Even one time when I wanted to be a nurse, it was like, especially in that time, I think like a nurse is very prestigious, right? It's a lot of training. But I think at that time, she's like, no, like a doctor. It's not, you're not going to be, and she was a nurse, but she's like, I want you to be, at least think about like yourself as a doctor. Like, that's how I want you to envision yourself. But it wasn't like explore different careers, use your creativity. It was none of that. It was like, you're going to be a doctor or a doctor, maybe a lawyer, but probably a doctor. So like, okay.
But what was the aha moment for you that you found out that you actually was passionate about it?
It took a while, because I think it was like, this is what's gonna happen. I might as well fall into it. But I think when I really realized how much work was involved, and I was like, I need to make my own decision here, because this shit's a long path.
It's a lot.
Like, this is not something to do passively, right? Like,
talk about it.
This is years upon years upon years. You miss the weddings, you miss the birthday parties. It's just like, it's so much sacrifice. But I think I was kind of hungry for that challenge sort of thing. Like, I think that was cool. And when I was in college, I majored in anthropology. I didn't major in a science field, and I just loved like medical anthropology. I thought that was, people think medicine is so objective, and I think we're learning more and more that is not the case. A lot of it is an art. A lot of it is there's rampant bias. We bring so much culture into medicine, and I thought that was fascinating to me. And so that's kind of where it first started, I think, for me. And then, in terms of choosing GI, which is like butts and guts and blood and all that stuff that nobody likes to talk about. What you say?
Just gonna let us slide.
I know because she's a doctor, but I know.
Yeah, I was gonna let us slide on that one. Honestly, like
I know.
I said butts and guts. I was like,
but the finger was on the button.
Which button is he gonna press? Which button?
I'm gonna be honest with you though, Doc. I'm gonna be honest with you, right? I know I'm gonna toot my own horn. I've helped a couple people go through nursing programs. My daughter actually is about to graduate from Stony Brook in June. She's in the nursing program, but
that's fantastic.
I've helped a couple women that I've dated before go through the nursing program. So I've walked this thing through. I ain't gonna lie. I seen just one of those textbooks, just one, right? Opened it. Reading the dictionary is one thing, right? You know, it goes from like easy to medium to hard. I feel like every fucking word in that book was like 17 syllables. I'm gonna be honest with you. Doctors are special people. Like I believe you have to have like a special ineptitude for that. Like I don't think that everybody can do that. Even if
I'll be born with it.
Yeah, I'm telling you, right? I think even if you wanted to do it, like even if your family did it, I still don't think that everybody can do it. Like I think you have to have like a special gift to be able to like go into that field. Because I looked at one page of all them words. This shit gave me a headache. I was like, I would never.
Well, they say it's another language. It's like learning another language.
Yeah,
you said anthropology. I was trying to look it up. I spelled it wrong. So can you tell us what that means?
Sure. Yeah. That's
spelled it wrong all the way. I know one of my listeners did the same shit. I know y'all did. Put it in the chat, yo. Don't lie to me.
The study of man and culture, but with the medical twist. Yeah. But I mean, I
call it humanity.
Weapon?
I call it humanity. The study of humanity.
Yeah, it is. It definitely is a lot of that too. And but you know, with GI, butts and guts, there aren't a lot of us. There aren't a lot of women.
Right.
Like less than 20%. There aren't a lot of Black women. I mean, there's less than, the latest statistic tells us there's less than 600 GIs that are practicing in the whole country. 600.
My fault. I meant to give you that one.
Really quickly, Doc. A lot of our listeners don't understand what GI is. Can you tell them what the abbreviation of GI is and how?
Thank you. So GI stands for gastrointestinal. So when I say GI doc, it's like a gastrointestinal doctor. So we're talking about like people who do colonoscopies, people who look inside your stomach, people who deal with diarrhea, constipation, blood in the stool, liver problems, abdominal pain, that whole thing. So diseases like colorectal cancer, we diagnose things like irritable bowel syndrome or IBS, Crohn's disease, ulcerative colitis, reflux, a whole host of things, pancreatic cancer, stomach cancer, liver cancer, hepatitis B, hepatitis C, I mean, celiac disease, a whole host of things. So so that's us. And you're right, a lot of people don't know what we do. But and a lot of people don't want to come to us. Nobody likes to see me, certainly, because people generally don't like talking about that stuff. And so I think that kind of draws me closer, right? There aren't that many of us in the field. There's so few women, there's so few Black people, so few Black women by extension, that I was like, I need to be in this room. I need to be here. So I said, I'm not going to do primary care. I thought that this was just like a procedural field. I get to use my hands, get to do procedures on a regular basis, and talk to people about things they just like, try to make them comfortable about things that they hate talking about.
Yeah.
Is it more reactive? Like, because you said like people don't like to come. I think when people go to your speciality when something's wrong, they're not being proactive and like just checking it out. Like, so like, can you tell us how we should be looking at it, right? To make sure we're
you're right. So most people see me when something is wrong. I'll say the people who see me when they're feeling well are usually people who are getting screened for colon and rectal cancer. Gotcha. Meaning like, so when you get a screening test, it means like you feel fine. You're looking for something that doesn't cause any symptoms. And so it's very fitting because it is actually colorectal cancer awareness month. So you guys picked a good time to call me.
Let's talk to them. You educating me, man.
Yeah. So since I have a primed audience, I'll say that colorectal cancer, unfortunately, is on the rise for people under the age of 50. So, Chadwick Boseman died of colorectal cancer, unfortunately, at a very young age. A good friend of ABGH is the organization that I'm the president and co-founder of. James Casey, who is this incredible musician. He played for the Roots. He played for Meghan Trainor, Trey Anastasio, Dave Matthews Band. And he was diagnosed basically like during the height of COVID at age 38 and died 2 years later. And there's so many other people, right? So many other people. And, unfortunately, the common thread is that these people were Black. Colorectal cancer happens more often for people like us, unfortunately. We die at higher rates. We're like 40% more likely to die from colorectal cancer than white people. And so people need to come to see me, or people like me who do what we do to catch cancer early. Because when we do, then it's more likely to get treated. You're more likely to survive, but you got to take that first, second, third step. And so that's what's really important.
You know what it is too? I just want to add this because I'm gonna share this with the audience, ladies and gentlemen, because you know what? We don't hide anything on the show. The reason a lot of people don't know what the symptoms are is because when we talk about family lineage, like when I went to the doctor all of these years being in the military and everything, one of the first things they say is, does this run in your family? Do you have a history of this? A, B, C, D. And my answer has always been, I don't know, or no, because my parents and my grandparents failed to kind of teach us the lineage of what was going on with the family. I just recently found out within the last year or two that cancer actually ran in my family. And I said to my mother, like, why wouldn't you tell me that? Like, why would that be something that you don't say, hey, by the way, did you know this? You understand? But I'm in my 40s at this point. So you understand what I'm saying? So now the other day, a couple months, maybe like 2 months ago, I went to the doctor and said, you know what? Let's go from A to Z. Right, Cuzzo? And I've been going to the doctor now, and now my answer is I don't know, so let's check for it anyway. You understand what I'm saying? Because I don't know. I don't know, right?
Yep.
And although I'm not gonna lie, right? Although some of these procedures a little invasive, we don't want it done. I rather know and be proactive than not know, right? So I actually signed up. I'm actually gonna see a specialist, a GI specialist. I think next couple of weeks because I want them to actually do, I'll be 46 this year, so I want them to be, I want them to get it done because I'd rather know, right? I'd rather know. I'm gonna put the pride to the side. I'd rather know, so I can be proactive. So at least I can say, at least I did it. So I know. So a lot of it is education from the family. Yeah.
I love what you're saying right now. You hit so many points. I don't even know where to begin.
Yeah.
But number one, kudos to you.
Yeah.
For getting that colonoscopy. I can't wait to hear on the podcast all the details.
No, we're not. You guys, I don't want to hear about his ass on the damn show. Our listeners do not.
They got that. That's about the most they gonna get.
I want to vlog. I want to see the whole experience start to finish. The prep.
I'm
just gonna throw the thumbs up, like.
That sounds wild.
That sounds wild. You know what? In the history of the podcast, I don't think that I've ever given myself a whoa, but you know what I'm saying. That was kind of crazy. I ain't gonna lie. That was kind of crazy.
But in all seriousness, yes.
He had to give him one. He had to give himself one.
I had to give myself one on that one. I ain't gonna lie.
Oh yeah, no. It's well deserved. It's well deserved. But no, we have to talk about these things, right? I mean, family secrets like that can kill because people are, I think especially in our communities, very hush about that stuff. We don't talk about that stuff. We're minding our own business, but that can, if you talk about it, you can really save a loved one's life. You can save a family member's life because if you have a family history of colorectal cancer, you should start your screening earlier than people who don't. So I encourage people to ask their parents, ask their siblings, like, what's your medical history? It's not to be nosy. It's so that, if anything, it's, it's selfish for yourself, but it's also affects their children. It affects your children. And so it's critically important. That's like a big risk factor for colorectal cancer.
Yeah.
And I think like the other point you touched upon was, it's invasive, but it has to be done. I mean, I think there's a huge stigma about, booty holes, cameras, men.
Hey, yo.
That's exactly what our audience is saying. That's what our audience is saying.
That's what I'm saying. Like,
that's what they saying. They're intelligent, but they're immature, Doc.
Right. I am. I'm like, you want to put a camera where? Nah, that ain't happening.
But it's such a huge reason why people never make it to the doctor. And it's the best sleep you'll ever have. You're gonna get some great medication to make you sleepy. It's obviously a non-sexual, totally medical. Like, I don't remember people's butts. I don't remember what their colon looks like. Like, and you don't want me to, right? Because that means everything was fine. But there's such mental gymnastics that happen in some people's heads. That will just not allow them to take that first step. But I also tell people, if you don't get screened on time because you're worried about a colonoscopy, you may have many more colonoscopies in your future, right?
Yeah, that's real.
Much more invasive things in your future that you don't want and you could have prevented. And so that's really important. And I hate it when
it's mostly us. It's culture.
It's sad to see.
That's what I'm saying. It's a culture thing.
It's the culture.
It's the culture, but I just want to ask you this, Doc, because you touched on something that I think we really need to just dive deeper on a little bit. The fact that you said a lot of these cancers don't have any symptoms. See, you mix that with the problem that guys in general, men in general, don't go to the doctors as often as women anyway, right? We don't, women go for the annuals, the pap smear, the breast. Guys don't really do it anyway. So we, like Cuzzo said, we only go when we think something is wrong, right? But so I'm trying to think, how do we raise the level of awareness when these are so many things that don't cause any issues to let us know that there's something wrong? Yeah,
that's a good question. I think that's why I think it's so important for men, even if they're young and healthy, just to see even just like a primary care doc or a primary care, professional. Because that's the doorway for them to see me, right? A lot of times they have to see them first. But when I was talking about how, unfortunately, for Black and brown folks, we have worse rates of colorectal cancer and we're more likely to die from it. It's not like it's on us, and that's not my message. A big part of things too is that people aren't recommended to even get a colonoscopy. So that's where that medical anthropology comes in. That's where that bias comes in. Like, why? Like, is there an assumption that I'm just not even going to go? Like, why aren't you recommending this to me, though you're recommending it to X, Y, and Z? And so that's why I think through community, through things outside of like the office and the hospital is where awareness really needs to happen. It needs to happen in churches, it needs to happen in barbershops, it needs to happen at hairdressers, it needs to happen at family functions, because I think that even has a bigger impact in a lot of ways than the doctor's office can, because people may not even make it there otherwise.
I want to get in tune with this.
Yeah, we're gonna know.
Are you ready? We need this. We need this because
into the shits.
I'm being honest, Doc. Like the campaign right now is health is wealth, and we don't say that lightly, because we are just turning around every single day, seeing way too many people pass away early. You understand what I'm saying? And when I say early, we're talking like 30s and 40s. Like you're not even becoming a senior anymore. You know what I mean? But like I said, it's the lack of education. It's the cultural bias that comes along with these things. When you go to the doctor, you're not being recommended it, right? Cuzzo, if they look at you and you, if I go to the doctor, normally I have a great bill of health. They're gonna be like, you don't need that. You good. You look good. You look fit. They don't. You know what I mean? It's like I feel like we're up against a big brick wall here on how to get this information out. But I feel like we really, really need this, and not only for cancer, but just diabetes, right? Hypertension, and everything. Because I feel like we are dealing with more health problems now as a community than ever before. What you think, Cuzzo? I'm feeling like
I want to ask you about, are you limited based on your role, doc, and based on the hospital you're associated with, are there limitations of what you could do outside in the community as far as spreading the information? Like how does that work? How do you build your profile within this community? Because there's only 600 of us. How do we get referrals? How do we do all of that? Like, I want to know the business of that.
Yeah, that's a good question. I mean, every hospital, every institution works differently in terms of what you can and cannot do, especially if you're being compensated financially.
Yeah.
But there still are a lot of avenues. Like, I mean, ABGH is one of those examples. Because there are so few of us, we just saw this need to let ourselves be known to help people who otherwise don't have access to us. Because we know that, like, if you see a Black doctor and you're Black, that concordance, that, you know, that similarity can save lives. Like, there are studies that show that even when there's one Black doctor in a community, where there's Black populations, Black people, they do better, right? I mean, that is something that has been shown, that is studied and been shown. So it's not just lip service. It's not just like, we just want to diversify things or we want to make things heterogeneous. Like, it actually improves and like outcomes. It saves lives. So, you know, I think that it's very institution dependent, but there are ways through other like medical societies that we either create ourselves or that we work with to get this important message out.
The problem is, I'm gonna be honest with you, doc. Doctors are good at what they do, but they're terrible at marketing. Terrible at content.
Awful. Pitiful.
Yeah, it's crazy. It's like you do this, like, we're gonna do the social on the thing. We're gonna do this right up on this, and it's like, how do we make that more? We got to make it more digestible for the audience, for our community. How do we do that?
We can't help ourselves. So you guys were talking about these like 7-syllable words and like Latin origins. Like, we can't help ourselves, but to use medical jargon. So, I mean, I wish that in medical school there was like media training, ways to really talk to patients without using medical jargon to get the point across. Because especially now, I mean, I graduated med school in 2006, but I mean, now with social media, I mean, there's no social media, but, and there's so many people on it. It's so critical to put out the right information to groups that you want to target in a way that people can actually understand things and like motivate them and like make them be their best advocate. And that's really hard. Like I you know, it's easy for us to fall back on using jargon that we know, because it's almost in some ways like a kind of like a shield. You know, it does cause that separation, but we are really terrible at it. I agree with you 100%.
You know, there's only one thing to say about that, because
we got to pay some bills. We'll be right back.
So for any hospital doctors, associates, physicians looking to get their social media up, you can call OTB Digital. You can scan this QR code. Numbers right now. I'll give you the number. We are open. All right.
I am
you how to do social media, how to build relationships and revenue on LinkedIn. We could put you on the show. You could talk to the community yourself, just like Dr. Sophie is. So you talk to us, you holler at us, make it happen, and get you a shirt, a beanie, and a hoodie while you're there.
Yeah. Hold on. You know, you gotta be careful, Doc. Like, putting anything by the rim, he's like Shaq with it. Like, anything that's by the rim is going down.
You said that I wish there was social media training, nigga. I almost fell out the seat.
You know what I want to say to you too, Doc? I just thought about this, right? Another reason that we don't see a lot of, let's say, air quote, specialists, right, is because of the type of insurance that we have and the process in which it takes to get to a specialist, right? Now, back when I was working, I think I had Aetna Open Access, which I think is one of the best, right? Because you don't need a referral to go to these specialists. You can just call them up and say, hey, this is what I would like, right? Can you talk about how, you know, like, what is the process to see a GI? Do you have to normally get a referral from your primary, or do you feel like if this is something that you want, most people with, you know, most insurances can kind of get in contact with a GI directly? Like, what's the process like that? Because I think that's a big issue with people seeing specialists, the process in which they get approved through their insurance companies.
Yeah, that's very true. I mean, it's like, it's insurance dependent, and even with each insurance, there's like specific plans within that insurance. So it's like a minefield, but so some people can come directly to me without their primary care say so, or referral, or, you know, permission, whatever you want to call it. Insurance is permission. And then other people have to go through their primary care, which oftentimes like makes the process slower, right? But I think because when you think about how much fewer gastroenterologists or stomach doctors there are compared to like primary care, I think it's a way to decrease the amount of people who may come unnecessarily. But at the same time, there are people who need to come that are not getting those referrals, right? Or like they talk to their primary care, they say I'm having blood in my stool or blood in my poop or like belly pain or what have you, and they're not making their way to me. Because, you know, another thing, when I was talking about all those different diseases that I treat, there are some diseases, particularly like Crohn's disease, ulcerative colitis, which are these diseases that cause like a lot of inflammation in your gut. And you can have blood in your stool, really bad belly pain, losing weight when you're really not supposed to be or not trying, can increase your risk of cancer. But traditionally, people think that's a white person's disease. Black people don't get these diseases. So you go to your primary care, you mention these things, and they're like, you don't need to see a GI. Like this is not even in my mind that these diseases are happening to you, because there's that bias there.
Yeah.
And so then people are kind of trying to survive their day to day, feeling like crap, no pun intended. And then they don't see me for like 10 years. So it is like a way of gatekeeping, right? Like these referrals and like not being able to see me directly. And that's why we need other avenues to get to reach people outside of the doctor's office.
Yeah, it's so many directions we could go with this. Yeah,
no, but I just have one thing, cuz I call it straddling the fence, Doc. See, I hate straddling the fence. Like I'm fundamental. Like give me a clear message and let's run with it. If the message is proactive, not reactive, saves lives, then when you say like a person comes seeing you unnecessarily, how is it unnecessary when I'm being proactive? Not from like that's the way you feel, but the way that they feel, right? Right. The system works, right? It's almost like if I don't show signs of being sick already, do you not deem this visit as a necessary precaution? So do you want me to be proactive, or would you rather me be reactive? That way you can say, we know there's something wrong and now we can charge them and put them on medication. And what's the message here?
Yeah. Well, I think when we think about proactive versus reactive, I think proactive would be like, it's time for my screening. I know this is the age, which is 45 for most people. Right. I'm going to head to my gastroenterologist and get screened. Yeah. But other than that real scenario, things often are reactive. But I will say that sometimes people have what they think might be a gastrointestinal issue, and it's not.
Okay.
And so there's very non-severe, mild symptoms that might be like heartburn or something, where the primary care doctor can easily treat that and they don't need to see me. Right. So I think in those types of situations, I don't necessarily need to be seen. And so that's when I say sometimes those referrals exist so that doesn't happen and people can get treated much more quickly, as opposed to seeing me. It may cost them more, you know, and they don't really need to see me in the first place. They could have just gotten that done with their primary care. So that's what I mean when I'm talking about like some visits might be unnecessary, or like chest pain and they're waiting to see me for months because they think it's heartburn, but it's really like their heart, you know? That's why I think it's so important for people to have a primary care doctor, because you can always mention those problems to them. You can see them on a very regular basis. Generally, you can probably get an appointment much more easily than seeing a doctor who is a specialist who has appointments booked out for a long time.
Yeah, it's a lot. I really want to talk about the biasness. I want to talk about the business. There's so many different things. Like, I'm curious if you have a story. Obviously, you can't. So I don't really want no patient information, none of that shit. But like, was there a story where you caught something based on being a Black doctor, you treating a Black patient that normally, like, what are some things that you're looking for that a non-Black doctor would not see? I'm just curious what that looks like, because we had Walt. I want to ask that. We had Walt on the show. He talked about the Advil campaign. He told us about a story. It was a Black man that was actually in the waiting room for like 10 hours, died in the waiting room. We've heard of different treatments, right? Not thinking that because, like you said, with the Crohn's disease, oh, they're Black, they wouldn't get that, right? And they end up dying from that disease. Like, so what are some stories that one story that sticks out to you that you don't mind sharing with us?
Yeah, I mean, I think a lot of that stuff happens not infrequently. Okay. I'll say that
See, look,
Crohn's
that's the
disease.
man. That's the man
See,
calling.
I
No,
told you.
man, no.
That's the white doctor
Don't be trying to
calling
get
right
into the
now.
shits. You see what
No.
we get into the shits. Come on. Come on.
We're getting to the shit. Exactly.
Exactly. Like we going to the doctor. No referrals.
Listen, we are beholden. We are at the mercy of the insurance companies. It is so
Right.
pathetic.
Ah,
Yeah, I'll say a positive story. I was treating somebody's son who's referred to me, and he was in his college years, and he had inflammatory bowel disease, and he came with his mom, and his mom was age appropriate for a colon cancer screening.
Okay.
And so she came in, she had her colonoscopy. She comes to the front desk. She's greeted by our medical secretaries who happen to have racial concordance with her. She goes to she's called by one of our medical assistants, also happens to have racial concordance with her. Then we take her into the room for the colonoscopy. The anesthesiologist, myself, and the tech in there all have racial concordance with this patient. She goes to recovery, the nurse, same thing. And she was just, every step of the process, she was overwhelmed with, honestly, just like relief and comfort. And she just kept gushing about how she felt like so relaxed. She felt so relaxed and relieved. And she's like, I can't believe there's all these Black people around. Like, I can't believe all these Black people are taking care of me. And they were all women. That was the other thing. They were all women. And so she's in recovery, and she's coming out of anesthesia, and she started crying. And so in rare cases, sometimes the anesthesia can cause this like abnormal emotional kind of response. People might do that. And so at first that's what I thought. And she was like, no, I'm just happy. Like, she said, can I have my phone, take a picture with y'all? And so it was really sweet. And so she takes this selfie with all of us. And then the day goes on. And then at the end of the day, she's long gone. It's hours later. There's a delivery at the desk. And it's these flowers, and it was beautiful flowers that she sent for the whole office, just thanking us just for doing our job. And then the next day, she sends those edible arrangements,
Fire.
again, thanking us. And and obviously it makes me so happy, but at the same time, it's unfortunate, right? Because this is a lot of people's norm.
Yeah.
This is a lot of people's norm to be treated by people who look like them. And for us, that's not the case. And I think a lot of people worry, am I going to get treated properly? Am I going to get treated, fairly? Am I going to get the right treatment? Because I'm Black,
Real.
And so I think that was part of her anxiety.
I got to jump in real quick, Doc. Your father worked at Lincoln. Let me tell you something. We from the Bronx. Be clear. Yeah. We from the Bronx, right? Before we even worry about what color the doctor is, it's what hospital you taking us.
Yeah. And for what? And for what? Like, if I get shot, I'm going to Lincoln.
If I get shot, do not take me to Jacob. Like,
go to Lincoln. Stop. Just go straight to Lincoln. Any bullet wound, stab wound.
I don't care what the doctor look like. We worried about the hospital. Like, where you taking me? I'd rather, no, send me home. Because
my chest hurt. I'm going to Einstein.
I'm being honest with you, Doc. Like,
you're right.
The stigmatisms be on the hospital themselves.
Yeah, that's true.
Before you even get to see what the doctor or the nurse look like.
Right.
What does the building have? Like I said, we from the Bronx, the big, Lincoln, big orange building, 149. Most of us been there a bunch of times, but be honest with you, like the level of care that you get at Lincoln versus, let's say, an Einstein or Jacoby, it's completely different. It's completely different. I'm being honest with you, right? Bronx, Lebanon, in the Congo. Right. So a lot of times the stigmatism is actually placed on the hospital itself. And I want to talk about that because, again, we talk about education. Some of these centers are trauma centers, right? Some of these centers are specialized in childbirth, prenatal. Each hospital is different. But you will end up not going to the place where you should go, that they actually have the best technology or the best people, the best care, because of the stigmatism that's put on the actual building itself.
Right.
Like it's a lot that we're dealing with over here.
There's a lot. Yeah. There's a lot. And sometimes you just, you're so overwhelmed, you don't know where to begin. Like, what's the root of the problem.
Yeah.
But you're right. I mean, there's a lot. I mean, when you think about New York City, like all hospitals are not created equal, unfortunately. So it's one thing with like the person who's treating you, but yeah, like what about the building in which they work? That's very true. So there are stigmas with certain, or I'll say reputations, maybe.
Yeah.
With certain hospitals and things. So it's tough. It's tough. And you know, the fact that
Overall
like
patient
sometimes
care, overall patient care on
Yeah.
just a regular basis, right? If I go to the ER for something like, you know, the flu or COVID or something, and I'm there damn near 48 hours, they got me sitting on a gurney in the hallway or something, like, it's no way if I have something serious, I'm going back to that hospital now. Like, you understand? Like, why would I do that? If you treated me like this for the major stuff, why would I go back to, like, it's a lot, doc. I ain't gonna lie.
But that goes back to the earlier question. How do you get your referrals, right? If I'm a primary care physician, right? Who do I decide to get my referral to? Is it based on the work, based on what other customers or patients have said and all that? How do you make sure that you're top of mind for those referrals?
I mean, it's based on symptoms, primarily, but you gotta, you know, that's why having a relationship with the people who will be referring to you is really important. You know? When you treat your people well, and meaning like the patients that they send to you, and you know what you're talking about, right? Obviously, you have to be competent, are important. But I'll say that majority, and you know, where I work, I'm looking at my window right now. Where I work, not necessarily predominantly Black, but like the majority of my patients are women, and the majority of patients, particularly for Crohn's disease and ulcerative colitis, are Black. And I don't think that that's a coincidence. You know, I mean, people will say, I had a patient today who said, I waited 2 years to see you. What? I mean, and I was like, 2 years? I mean, I know it's hard to get an appointment, but I think the point is that people are willing, if they can, right? And sometimes when they shouldn't, are willing to wait to get the doctor that they think will hear them, see them, understand them, have shared experiences with them. And so that's why we need more people who look like us. And not to say that every Black and brown doctor, every female doctor is going to treat a female or Black and brown patient, you know, the same or how they want to be treated, but there's definitely something to that.
Yeah, man, I can hear the passion when you talk about it. So like now I get excited about it. But now you said earlier about the sacrifice, right? So we need more Black doctors to be in the room. We need more Dr. Sophies, right? Tell them about the sacrifice that you made to even get to this point, because they have to understand that, right? Like, what are some of those? Like you said, you're missing the birthday parties, you're missing that. Like, tell us some of the most difficult times and how you got through that, because it is a difficult journey, but it's one that's needed. So we need them to know exactly what this looks like.
Yeah, I think it's a long road. I'll say after 4 years of college, it's 4 years of medical school. Now sometimes it's 3, depending on the medical school you choose, but 4 years of medical school. And then it's 3 years of internal medicine residency. So you're still training, but you're getting paid very minimally. But you hands-on training, like you're working, but you're also learning. And then after that, it's 3 years of GI training, which is called fellowship. So it's basically about 10 years after college. But it's like the prime of your life. You're in your 20s. I mean, I went straight through, meaning I didn't take any breaks or take time off. So it's like you're in your 20s. It's the time to be having fun. You know, or entering adulthood, but like you're not really. But so I think that that's hard for friends that you have that are not in the medical field to kind of understand what you're going through and understand what you're seeing. Like you're seeing people die, you're in people's bodies. Like, you know, you're doing stuff that's just, you have to have a certain mindset and maturity for, and you have to learn very quickly, how to have difficult conversations with people about their family members dying, about having serious illness, about all those things. And not everything is taught. Some things you have to learn as you go. And that's really a lot of sacrifice, I think, both physically and financially and emotionally. You know, the stats aren't good for mental health issues and suicide with doctors, and I think a lot of that has to do with the training and the life.
Damn, I never thought about the suicide rate for doctors. So
it's definitely higher than the average person.
But what do you do to balance that out to make sure you don't bring the work home? Like, what do you do? What is your getaway? What's your escape?
I exercise. I love to run. I've always loved to run. I think it's a great escape.
Shit.
Does that mean you don't
I'm sorry, Doc. I'm gonna let you go. When you talk about running, I'm like,
hate it.
It's good. We're gonna start it, bro.
I'm sorry. I ran the last couple of days and I said to myself, how does anybody like this shit? Like
more than a title marathon.
You cannot. When motherfuckers that run these marathons and these 5Ks, I commend y'all. Y'all runners, y'all a special breed. I can't.
I love it. I can't. It is a huge stress relief.
Right.
I mean, just like, my husband's a doctor, but I think that at the same time, though we can understand each other and understand that language, I think travel has taken my mind off. It's the best way to just like disconnect for sure. I got to get away. I think a lot of doctors don't take their vacation. I take all the vacation. I take all the vacation.
Message.
Yes.
Take them. They there.
That's right. That's right.
Okay, I got a funny question now. I got a funny question. Here we go. Let's I want to lighten this up a little bit.
Let's get it.
You're a doctor, your husband's a doctor, right? What is the dinner table and like grocery shopping look like now? You know what I'm saying? Because like you a GI, so if he wants like an Angus burger, I said you can't eat
that. That ain't gonna digest, motherfucker.
Let me bring home some pork chops. Babe, you can't be eating. What does that look now? You talk about bringing your work home. How do you not now that you're inside of people's bodies, you know what goes on, you know what causes things. What does grocery shopping look like for a doctor couple? What does eating even look like for you guys? Like,
he's the healthier
every day, like
he's the healthier one of the two of us.
Okay.
I think that mostly the issue is that we have no problem talking about poop, deuces, all that stuff. And I think our daughter has become totally okay with it. But I'm the one who kind of cheats more than he does, to be honest.
Fine.
Okay.
I can see it.
But yeah, I mean, I think it's more so just like total freedom to talk about anything that relates to the body. That's definitely it.
Okay. Because I eat healthy a lot. You know what I'm saying? So when I go out a lot of people make fun of me because I eat salads a lot. And, I'm pretty like a healthy dude, like year round, right? Everything I eat, it has greens and stuff like that. So sometimes I ain't gonna lie, like sometimes like the other day I was in the supermarket, I seen some good cut pork chops and I'm like, I started licking my lips like I ain't had a good pork chop in a long time. Like
Jarrett, how about you?
He's like that, Doc.
Yeah.
We be on drink. We be on vacation. We at Rohan Marley crib. We sit at Walmart or some shit. You gotta get the turkey bacon, nigga. If you don't get this turkey bacon away from me,
wait, Doc. You see, so that's why I asked you that question, right? Because me and him go through that, right?
Right.
And that's the perfect example. We was in Walmart. He picked up the regular bacon. I'm like, you gonna get the regular bacon? He like,
I'm going for the regular bacon.
Come on, it just doesn't. The turkey ain't right. Come on, fam.
A lot of times we'll pick up different seasons. I'm like, you gonna use that season? You don't got a lot of salt in it.
Oh wow, we can't go out with you.
That's the flavor. We on vacation. I'm like, bro. We're in the middle of Walmart. You got your cart. I got my cart. Because we can't do this no more.
So you see, so we go through it. So that's like I said, that's why I asked you that, because it's interesting to know. And we're not medically trained, professionally trained at this.
Yeah.
But like I said, we're trying our best with the limited information that we have. That the moral of the story is I'm just trying my best. I'm not a professional.
Right.
I'm just thinking if I eat less things that I hear are toxic to the body or not so good, then maybe I'll, lower my chances for me contracting these things. And then when I'm around my cousin, because obviously I love him to death, right? I just want to make sure he's as healthy as possible. Sometimes like, yo, you done had like 3 Pepsis today.
Oh my God.
I'm like, no. It'd be the worst times too. It'd be like if you did it early in the morning, like 11. I had just finished smoking or something. I'm saying I got 3 din dudes and he's talking about some damn Pepsi. If you don't get out of here with this, bro.
Well, before you came on,
before
you came on, he was talking about Big ZD.
You should. I'm ready to heat that thing up now.
Yeah. But again, Doc. So what I'm showing, but see, we don't understand. And this is why this is so important for the marketing from you guys, right?
Right.
The marketing from you guys to the general public, right? Because you might not think that we're paying attention, but we're paying attention. But if it's not, like Cuzzo said, if it's not easily digestible, we're gonna get lost in this thing, right? So like I said, for most people, just make it like basic. Like, what can I eat? What should I stay away from? Like, okay, I can have pork, but not more than twice a week. See, I can understand that, right? Or, like red meat takes 3 days to digest. So, red meat twice a week. Make it kind of simple, because once it becomes complicated, then we can't follow it. You know what I mean? Yeah.
You're right. You're right. And, the other question is, and I'll ask you guys this, like, what's the best way to get information? Is it commercials? Is it social media? Is it written out? Is it from your doctor? Is it from a celebrity? Is it from your family member, like community leader? Like, what's the best way, you think?
That's a great question.
You want me to go? You want to go?
For me personally, I think social media is storytelling. So that's what we tell. I'm looking for three things, right? I want you to educate. I want you to inform. Now, a great video, a great story is going to have all 3 of those elements, right? So now, when you just told the story about the young lady who came there with her son and like, that's a great story. Now, if you had that in an infographic or something like that, or something 3D or something or cartoonish, but it shows that story, then somebody can look at that on social media and be like, wow, how do I know I don't do that? You know what I mean? How do I know I'm not with this? We need to make it where it's just in our face, because we're scrolling all day. We're worried on Shade Room. Rick Ross is beefing with this one. 50 Cent said this shit. This happened. They just canceled this over here. It's so much shit going on right now. Where if you got some shit that's just like, it's the best information in the world, but it's just straightforward, it's by the book, you're not going to get us. So what is going to be something that we could do? I just think it needs to be more entertainment based on what you guys do. So what would you want to see? You're a doctor, right? But you're also on Shade Room too. What would you want to see? I think you have to think about it like that. I don't know if you guys are thinking it like that, but that's what I would want to see, right? How do I get there? How many times I should be with my doctor, right? Little statistics of, we love statistics. We love Snapple facts and shit. So give me a good Snapple fact. Yo, did you know this and the third happened? And oh, word, nah, I ain't know that. All right, cool. Let me put that implement immediately. So I don't know about, how do you feel, Cuzzo?
I like your answer. Mine's is pretty much the same. I just focus in on a couple things a little different. Like, I look at where the message is coming from, first of all, right? You can't tell me to how to work out if you look like you ain't never lift a weight in your life, right? So it's about like, you know what I mean? Like, how you training me and you giving me advice, you clearly can't even take your own advice. So I look at the messenger first, because if you're giving me information, I'm saying, how can you be smart enough to give out the information but not smart enough to kind of live by it yourself? So I look at the message. And number 2, I look at it as, can this be something that I can do consistently? I think that's the key to this thing, right? The key to any type of information and growth is, can you absorb it and make it a part of your life almost flawlessly, where it doesn't feel like it's a chore? Because once it feels like it's a chore, then you're gonna probably reject it, right? And then the third thing I look at is like the influence of the person giving it out. And this is where I agree with Cuzzo. Like, I think that people with bigger platforms like the Shade Room or, celebrities, right? People follow your every word. They following who you beefing with, who you texting, who you tweeting, who's divorcing who. But none of them are coming out really on a consistent basis saying, hey guys, are you getting yourself checked medically? Let me tell you what I'm going through medically. If Chadwick Boseman would have shared his story, do you think about the impact that would have had on how many Black people? The Black Panther himself going through something medically? Like, you understand what I'm saying? I understand it's private, but at that level where people are in your business and in your life anyway, I'm thinking, these type of lessons could save lives. So I look at that, right? Why aren't people in power with the platform sharing? You're sharing everything else. This is how many cars I got. These how many watches I got.
There's no movie at 2:00. Like,
right. But you're not sharing your personal journey medically, right? Until something happens and we hear about, oh, so-and-so hospitalized, waiting for further updates, or this one collapsed. But why did he collapse? Why did she get hospitalized, right? That's the part they're not sharing. So that's the kind that I kind of look at. Yeah.
That's interesting.
Yeah.
So I'll say this here because it's public information, but
yeah.
You guys know Tyler James Williams from Abbott Elementary?
No.
Everybody hates Chris.
Yeah, exactly. Everybody hates Chris.
That's the actor from Everybody
Hates Chris. Actor, the lead actor from Everybody Hates Chris.
Okay. I know him as Everybody Hates Chris. I don't know his name.
Like, I don't know.
We old school like that. We
thought his name was Chris.
He has Crohn's disease.
Oh wow.
He has Crohn's disease.
Wow.
And he talks about, we did this sit down with him, and he talked about this very publicly, but
right.
In just response to the reasons why people may not be public with it, even though they are public figures.
Yeah.
I think there's a stigma with, or maybe this perception of being weak, or perception that like you can't do the job, or you're worried that you won't get picked for a job. And so, or being known for that. Right. Mm-hmm. And I think like you're going to be known for your disease as opposed to being whatever actor or athlete or something like that. So I think it does get complicated, but at the same time, like what you're saying about that's what creates impact. That's what people are going to listen to if they look up to somebody. So it's tough. I mean, and I think it can humble people, and they don't want to maybe they want to be seen as like kind of superheroes. So it's hard to see these people as human, but I think sometimes that's the dilemma. That's the tough part.
That's the real right there. Being a superhero, saying that you're normal.
Right.
Saying that you're just like me. That's being the superhero. I'm just like you, fam.
Yeah.
So now if I don't know what Crohn's disease is and I'm a fan of your show, I literally just watched Everybody Hates Chris last night. And I'm watching your show last night. I'm seeing your journey, right? And now I'm knowing that you got this as a 36-year-old black man, father of two. I might be like, damn, I might have to go get checked for this.
There you go.
If it can hit him and he got money and this, then, and the third, that's when it'll hit us. We'd be like, shit, I don't have the resources he got, and this is what happened.
Right.
I'm eating regular bacon on burgers and shit. No, I gotta go.
See, but that's the part I'm talking about there. The impact over the metrics now, right? Mm-hmm. What if you were aspiring to be an actor, Cuzzo, and you looked up to him as an actor and he shared his journey and said, well, some of these diseases are genetic, right, Doc? They're passed down through, your line. So you can't help it if you develop them, right? But a lot of the things I think that cause us illnesses is the way that we take care of ourselves, the amount of sleep we get, the amount of water, exercising regularly, the things that we eat. If somebody says, look, man, to get to this level of where you guys love me at, this was my journey, but in getting to this level, I end up developing this disease by bad eating habits, not sleeping, because this can save lives, because you have a lot of people aspiring to follow in your footsteps, and now they can take that information and say, okay, when I get to these levels, these are the things to look out for. How do I maneuver this thing differently? That's what I'm talking about.
Mm-hmm.
Mm-hmm. Yeah.
You're right.
Yeah.
We gotta. First of all, you're gonna be our resident doctor, Doc. So anything, if there's anything that we need to know, please pull up.
I'm ready. I still want to hear about that colonoscopy.
Because
I gotta.
Because I think Michael J. Fox has an illness, right?
Yes,
Parkinson's. Yeah.
Parkinson's, right? And I'm gonna be honest with you.
Yeah.
I'm gonna be honest, like I followed him before, but I felt like he became more famous once he came out and said that he had it and showed his journey. He still was working, and I understand he's not, he's not from black and brown descent, but I'm just saying the message is the message, right?
Yep.
He came out, he shared his journey, and I felt like people loved him for it. They so much research, so much money. Look. Money raised for awareness of this disease to help other people, maybe early detection, get treatment. This is what I'm talking about, right?
Research.
We have to do it for the culture, for research.
And put us in touch with Chris. We need to do it. Everybody Hates Crohn's.
Right.
I have heard that title before.
Yo, I'm telling you, come on.
Oh, shit.
Come on, hold on.
I do it for the children.
Come on, man. If you could just scan one time, that was off the top of the chisel.
Doc, what did I tell you? I said you can't put anything anywhere near the rim. You can't put nothing anywhere near the rim with him.
That's a layup.
That's crazy.
Talking about this?
Nah, it's crazy.
That's a layup. That's out of here.
Yeah.
That's out of here. Done
Yeah.
right, edited right. That's out of here.
No.
Promise.
No. That's a fact. That's a fact. I got another question for you, Doc. So can we talk now? We talked about the sacrifices, but we didn't talk about the support during these sacrifices. Now, can we talk a little bit about that, right? You're in your 20s. You said you went straight through. So school, right? Obviously, a lot of your schooling, you're not working, you're not making a lot of money. How important was it to have the support system that you had at the time? And what did that look like to help give you the peace of mind to say, I can finish this, I can keep going, I don't have things to worry about? Because again, this is another important topic in our community when trying to follow your dreams, whatever they are, business, school, getting a job that requires a certain level of education. The support system that you have behind you is essential to giving you the ability to go ahead and go after your dreams. Can we talk a little bit about that?
Yeah, of course. I will say that you can't really, you basically can't make it without a support system. I think there's so many times where you want to quit, or so many times where it's just too much. And I think that there's almost like a trauma bond, quite honestly, especially in training, because it is rough. I mean, you were not sleep. You were talking about the importance of sleep.
Right.
You're talking about the importance of eating right. I mean, you were doing none of those things. Unhealthy habits. And you got to find your people. You got to find the people who see you day in and day out. And a lot of that time it is work people, because they know exactly what you're going through.
Right.
So I think that is key. And that's why I do feel blessed to kind of be in a medical family, because I could tell them what's happening and they know exactly what I'm talking about.
Right.
But I think, there are friends that I've had for over 20 years because I met them then and we've just gone through the same shit.
Right.
And as strong as you might be, or as strong as you think you are, you always need people. You always need people. Yeah. And so I couldn't make it without them. And there's, I'm close to them to this day.
So, that was a segue. So the next question is, we need a story on one time where you threw the books against the wall and was like, I'm done. I come on.
I hate it. I hate this shit.
It had to be a moment like, I'm not doing this shit no more. I don't care.
I don't know.
Oh, there was more than one.
I feel like you was in an R&B group and we had another dream.
Oh, there was more than one. I can't violate HIPAA.
Yeah, we need a good one. We need one good one where you was like, I don't care.
I'm out of it. If somebody said,
but I did have loans to pay, so
I
had to. But when I was in med school, I wanted to be an OBGYN. I said, I like women's health, let me be an OBGYN. And then there was this time when one of the trainees was like, the OBGYNs have a reputation. They have a reputation of, just being, they're pretty intense, I'll say.
I don't know what their reputation is.
So I remember this.
What's their reputation? I don't know.
What do
just kind of like queen bees, but not in a positive light. I mean,
okay.
Especially during training, they're like at least when I was in training, they were like a certain type of girl. Like, I'm not gonna say a bully, but just kind of, they had a reputation.
Okay.
And I remember they were teaching how to catch the baby. Right? How to we were going to do it as medical students. And I remember this one resident who was just like evil. I mean, she was just so mean. And she grabs my head. She grabbed my head. Yes, she put her hands on my head to try to act out a birth,
What?
And I was like, when something happens and you're in shock, you don't know how to respond, you can't even defend yourself. You're like, what the fuck is happening?
Hell no. No. I caught them hands.
Right. For real. You quick reflex of the shoulder. Snap of the shoulder real quick. What you doing? You don't touch a black girl here.
And you wish there's so many things you would have done.
Right.
Facts.
Most of which will probably get you out of med school. And at that point I said, why am I here? Why am I here? Why am I doing this? Why am I putting myself through this? Now people are putting their hands on me. It was so crazy to me. Almost unbelievable. Right. So it's like when you tell the story, that shit didn't happen, but it did. So, it's time like that, or I just don't remember in residency, you're dealing with some really tough patients. Like you're dealing with prisoners, you're dealing with, just all sorts of people who just want to make you feel like their job is to make your life miserable as hard as you're trying. And I just remember one specific, I can't really go into specifics about a patient, but I remember calling my parents and I was like, I'm done. I don't know why you guys made me do this. It was raining. I was pissed. I was so pissed.
There you go.
And they were kind of concerned. They're like, is she gonna quit? Like, what?
There you go. You was waiting for that bell.
What happened?
You was waiting for that bell right there. School's over.
I'm out of here.
I'm out of here. 3:30.
Oh, I'm out of here. People will test you. People will test you.
Absolutely.
People will not treat you well. But you have to remember why you're there. If you don't remember why you're there, it's very easy to fall out of medicine.
Message.
Talk about it.
So that's what kind of keeps me grounded. Because it's a tough and it's a long road. So I think that's why it's like you can do a lot of things with your medical degree, but if you're going to work with patients, it's important to know why you're doing it, and to stay focused. And like you said, to have support, because you will be challenged a lot.
Yeah, I've got to ask you now, what is the mama I made it moment? What is that one moment in your career thus far where you looked back and said, I made the right decision. This is dope. Like, this is why I do it.
But I can't, I'll say that I don't regret my decision. I think even during COVID, when it was definitely tested, because it was either me or my husband going in. Somebody had to go in on a regular basis because we had a daughter at home.
That had to be scary.
But that was a tough time. We're talking about mental illness.
Yeah.
There's a lot of that. And there was unfortunately a lot of suicide. There's a lot of terrible things that happened, but we got through it. We got through it.
That shit was scary. I could imagine. I was gonna say, but that can't be the mama I made it moment of COVID though. That can't be. What was the one moment like you glad that you made it through that moment? Because that could. They had body freezing.
Well, I'll say one thing that I think is important for folks to know is that we're humans too.
There you go.
I think sometimes people do forget that. We can have a shitty day. Something can happen at home. Like sometimes we're late. But I think sometimes people forget. We get sick, right? We get cancer too. Our kids get sick too. So I think sometimes that, like, it's human to human. I think sometimes people do forget that, and that's really important.
That's real.
But that's because people, again, like, and I'm not being funny. We got a comment.
That's Case in the room watching the show. Watching the show.
Listen, man.
Baby boy,
listen. I love you, godson. I love you, man. That's a testament to how we feel about you guys and what you do, right? Because we look at you as like a superhero, right? Because we know not everybody has the ability to take on that type of a task, right? Where you guys are literally saving people's lives, right? Like this clearly, in my eyes, has to be top 2 most important jobs that we have ever created as a coach, as a society. Somebody that has the ability to heal and save someone's life and bring in new life. Like what's more important than that, right? So I think with that kind of like, on that kind of a pedestal, it's easy for us to kind of overlook that. Yeah, you regular too, right? You got a family and you get hungry and you get tired. And, because we're looking at you like we need you, and we know that we couldn't switch places, right? See, a lot of people look at jobs. If you go to a job, let's say you go somewhere, right, and somebody doesn't do something the way you would have did, man, I could have did that shit better. Jump back there and made that burger better. You ain't putting no. Right. With a doctor or something, there's no way you're saying that, right? Because they know that they can't switch places. It's like that field is irreplaceable. So that's why I think a lot of people sometimes can overlook the fact that you're a human being, because it's like it's such an important job and it's such a special individual that it takes to get to that level that people are just like, we need you. You know what I mean?
Yeah,
like,
you're right. I never really think about it like that.
Yeah.
And but like back to the
That's
biasness
really,
now, right?
I mean, you're right.
But imagine us talking to people or going to doctors and stuff like that.
But I do realize, and I that I can be replaced, and I am only one person, and I can't be replaced at home, but I can be replaced, and so I think especially in recent years, I'm like, that's it's definitely like a priority check. I think especially after COVID, it's like,
okay,
putting
yourself first,
like what are your priorities?
Right.
Is really important, but I definitely appreciate what you guys are saying about how we reach people, how we talk to people, how we can break it down to help our people. And I'm going to take that back, because that's, I mean, as much as I have spoken with you guys, like I'm definitely hearing a lot.
I love. No, we learning a lot too. Like this is such a dope conversation.
Absolutely.
It's like we've had doctors on the show, but I don't think they practice medicine. Like we've had Dr. Matthew Knowles, we had Dr. Collins. They're more like on the educational side, right?
Yeah.
Like for you, somebody to practice. You're our first doctor here.
I think your cousin's eating big ZD right about now.
What happened? You can hear me? Can you hear me?
I can hear you.
I don't know. Oh, I thought I folded or something.
Can you hear him, Sophie? She can't hear you.
No, I didn't know he was talking.
Oh, she can't hear you.
That's what I thought. All right, well then you're gonna have to end it off then. I was just giving her love.
I don't hear anything.
No.
All right, hold on. Let me see. I'm gonna leave and come back.
All right. So no. So what he was saying was we've had doctors on the show, right? With the designation of doctor, but we've had doctors with the educational side of the doctorate, right? You are our first guest as a medical performing doctor with an MD, right?
Got it.
So that's what he was saying.
Mic check.
Yeah, right. Can you hear him now?
No, I'm sorry. I can't hear him. So I'm glad you're through him. No wonder you're like, why is he talking? No, I didn't hear what he was saying.
He was spitting game too. He was on the road. He was on fire. He was on fire.
I believe it.
I want to thank you sincerely. I want to thank you for giving us your time, and I want to open up, like my cousin said, I want to open up this platform to you and say that this is your platform now, right? We need people to come on and give out this information, right? We understand your schedule is tight and things of that nature, but if you ever feel the need that you want to spread some type of information, something comes up, you don't need a special request, right? You're part of the More Than the Title family, right? So what that means now is two things, right? Number one, this platform is now your platform. We don't have to ask permission, right? We don't need referrals. We don't ask permission. It's our shit. We do what the fuck we want to do over here. You know what I'm saying? Pfizer. So, that's number one, right? So if you ever felt like there's something like a epidemic, pandemic, something coming up, like, disease, something's running around, you like, yo, guys, we need to get this message out. You text us, we'll bring you on the next show, put a segment in there right away so that we can get this information out to the public. That's number one. Number two, if you have ever seen a guest on the show that you would like to connect with, or even future episodes, right? That you see people come on the show and you're like, hey, I would love to connect with this person, right? You just give us a text. Cuzzo, do we have her personal?
Nah, but I just put it in the group chat. So
okay, you can put your personal number in the group chat. What we do with every guest at the end of the show is we create a 3-way group chat with us, right? That way there's no managers, there's no assistants. That way, if you want to get in contact with somebody for the show, or if you have something, you can get in contact with us directly, and we use that as a direct line of communication. So if you wouldn't mind putting your number into the group chat, we'll start where
it says 3 people, not comments. So
where it says 3 people, not comments. So nobody sees that. That's just for us. And nobody sees that. Nobody's gonna.
I don't want spam calls.
No. So like I said, we do that because, like I said, just in case you haven't, and also, if you're in New York and you're at an event, or you have an event and you want us to support and things of that nature, you have direct access to us, right? Direct access to us, which again is important, right? Because some things are time sensitive, right? You might have a topic, or you might have something you're like, oh, guys, we need to get this out, and we don't need the red tape, right? A lot of times it's just too much red tape, so we don't deal in red tape. We don't gatekeep. Our platform is now your platform. Welcome to the More Than the Title family. So I
love what you do.
Yeah, so I'm gonna tell you, I know for a fact that we're getting a lot of comments and there's a lot of people watching. So I'm just gonna read to you a comment right now. The Modern Marvel said, really appreciate this conversation. Please continue these talks, right? So these comments are coming from Instagram and stuff. Yeah. You got a lot of people. AB, shout out to AB who just got better. He's on his healing process, just went through a medical procedure himself. Our thoughts and prayers go out to AB, get well soon, bro. He's recovering again, thanks to doctors like you, right? That, took care of him and things of that nature. So we know that there's going to be a lot of people that listen to this show and watch it and want to get in contact with you or find out more about what you do. What's the easiest way if somebody wants to follow you or get in contact with you for more information? Where can they find you?
Yeah, great question. So I'm on IG. I'm not on Twitter anymore, but you can find me at Sophie Balzora MD. Same handle everywhere. And then I want you guys to visit our website for ABGH, blackingastro.org. blackingastro.org. You'll find a lot of great information there about our events. We do a lot of community events. We have a map to find a doc in your area. It's a Black gastroenterologist and a lot of great patient resources.
Yeah, we're gonna and we put the link up. We put the link up right now as a comment, but that the link will also be a part of the show in the description if you guys are looking for it, because we always like to give out the information once we load this up to YouTube for all of our guests and things of that nature, so that you can always stay in the know. So once again, ladies and gentlemen, you know what it is. I'm getting excited right now. I got Godson in the camera. I know he's ready to end off the show. You know what I'm saying? Where we can't hear him, but this has been another episode, and I'm gonna use the word phenomenal. We had another phenomenal guest come on. We had another phenomenal episode, and she came in and she gave you guys great information, right? And one of the key takeaways to this thing is we have to start prioritizing taking care of this, the body and the mind, right? Yeah. Anything that goes on top of it, jewelry, clothing, and things of that nature is excess, right? If you don't take care of this, right, yourself, then everything else doesn't matter. It's no way that you're going to truly be able to enjoy life without taking care of yourself, right? But she also let you know that she came from a family of doctors. So they got busy. And at home, she had to get busy. She let you know that, listen, she wasn't in the club. You understand? She wasn't in the club. She wasn't in the lounges. She wasn't She stayed in them books. She stayed in them books, right? She
most of the time.
Graduations, and she sacrificed a lot to get to the level of where she was. And, and she told you, it was times where I wanted to quit, but I had to remember one thing. What am I doing this for, right? That's the impact over the metrics. So you know what that means, ladies and gentlemen, once again, how we end off the show every time. The dream is free.
But the hustle is sold separately, y'all. Y'all know the vibes, man. This is fire, man.
Yeah, ladies, man. I love this, man.
Yeah. You already got me out of here.
See how man, exited out by Godson. Who but us, man? I can't fuck with us.
What you know about me? I seen it all, heard it all. Oh, what you know about me?